Just checking to see if the kids are sleeping. My children are very, very noisy and very active. You have children?
Yes, one.
How many? Why?
Good evening, Zambia. Good evening, diaspora. Good evening, everyone. Welcome to this incredible presentation of TVBAKWETU. And I say incredible, and I mean incredible, because it's going to be a fascinating one. This is November, and it's a month where we advocate health for all men, or our men who are not very good at looking after themselves. So they actually had to come up with a date where, or a month even, the whole month, where we just advocate for their health. Like, come on, you need to look after yourselves. And as you can tell in my presence, we have been graced by the incredible, the brilliant, the fantastic Dr. Mujajati. Doctor, welcome to TVBAKWETU.
Thank you, and good to be here, and thank you for the invitation.
You're welcome. So now, if you're just joining us, can you kindly do the needful? You know what you have to do. Share the link to at least 5 people, because especially your men. Now, someone already has said, Linda, make sure that the other gender does not appear, right? I'm guessing you mean women. Which is quite funny. I wonder why. You know, we want everyone. So call your dads, your uncles, your husbands, everyone, your nephews, your nieces. We need to share this incredible information that Dr. Mujajati has. Now, Dr. Mujajati is a star. Is a celebrity. Here in England, we've got doctors who are quite popular. And I was just saying to him in the green room that he has made such an incredible impact on the men, including in my household. People in this house have started drinking water when they haven't been asked, eating lots of fruit when they actually haven't been asked. So this is thanks to Dr. Mujajati. What do you think about that?
That's incredible. That's quite something. I was just looking at our statistics, and I was quite amazed to see how that we are followed, not just in Zambia but in other parts of the world as well. And it's quite interesting that England is in the top 5 countries that follow our page. Quite humbling, actually.
So it means you're doing something pretty awesome, and that's really, really good. So before we get started into the topic of today, I really would love to know a little bit more about you. I just thought we'd have like an informal conversation, because I see this amazing doctor who's making waves online. The other day I saw one of your posts. You only posted a dot, and it's like thousands of reactions. I was like, who is this guy? Please explain.
I don't know where that came from. We were doing a social experiment. We are yet to analyze the results.
Okay, so there's a reason behind the dot.
Yes, there is. It's a social experiment.
Okay, I was confused. And people, I saw the thousands of comments. I was like, okay, hang on a minute. I know I'm very busy, but I'm going to spend a good 10 minutes just looking at what people are talking about. What are they reacting to? And the comments were hilarious. Absolutely hilarious. Okay, so
I enjoyed it. I was equally surprised to see some of the comments. Yeah, but I mean, there are chaps who are analyzing the results in the background, so we'll see what they come up with.
That's good. That's good. I would be interested in finding out what that was about. So now, Dr. Mujajati, just tell us a little bit about yourself. I know you were asking me about kids as the music was playing, as Ponchano was playing. You've got kids, clearly, because you were trying to get them into bed before you get down to business.
I hope they're actually sleeping.
It's fine. It's absolutely fine if they pop up.
I hope they're actually sleeping. Yeah, but anyway, it's school tomorrow, so I suspect they should be getting into bed by now. Yeah.
Okay. How many kids do you have?
So we have 4 girls.
Oh wow, that's amazing. Very expensive.
I'm surrounded by women, so you know how that I get all the attention. I have zero competition in my house.
That's
I feel sorry for my wife sometimes.
No competition, no extra testosterone.
No.
So where were you born? I saw one of your posts. You were talking about being Shona. Can you just give us a little bit of your background? I want to get to know the real Mujajati and the inspiration behind becoming a doctor and becoming a celebrity doctor, so to speak. Because let's be honest, you're a celebrity.
Right. So, yes, my father is Shona from Zimbabwe. My mother is Lozi from Western Province, but she was born and raised in Bulawayo, so she speaks fluent Ndebele. She speaks fluent Lozi. She also speaks fluent Tonga. She's quite a linguist, and I think I got that from her as well, because I speak quite a number of Zambian languages. So I was born and raised here in Lusaka in Chaisa compound. That's where I spent the first formative years of my life. From there, I went through the primary school, secondary school, up to university here in Zambia. I did my medical training at the University of Zambia from undergraduate to master's, after which I also did a master's degree in business administration, and most of my life I've spent it treating patients and also running businesses on the side. And now that I'm in the private sector, I'm mainly doing a lot of business. We just recently opened a clinic, so we run a private hospital here in Lusaka. And the issue about social media was really an accident. Accident in the sense that it was born out of a very painful experience. I can't say much because the matter is in court as we speak.
Oh no.
Yeah, so it was born out of a very unfortunate occurrence between me and my employer. It played out in the public. I think people who follow public issues or who are very keen on public affairs, they are quite familiar with the issues. But I can get into greater detail of what transpired because the matters are in court. But out of that painful experience, I was challenged by a friend of mine to start a Facebook page so that as a way of trying to move my attention away from my pain and focus on other people's pain as a therapeutic means. And I think it worked because in the end, I stopped focusing on my frustrations. I started focusing on people's problems through Facebook and trying to help people navigate their health. And from one follower to 1,000 to 5,000 to 100,000, now we are in excess of 300,000 followers. And when I look back and people start, like yourself, describe me as a celebrity, I find that a bit difficult to process because that wasn't the intention. The intention was not to become famous or to become popular or to become a celebrity, as people want to put it. The intention was just to help, and the intention remains the same up to now. That the page is purely for trying to assist the public. It's our gift to the Zambian public. It's basically CSR, if you like. And along the way, the page has grown. Challenges have increased, and the complexity is getting bigger and bigger because, as you can imagine, I run the entire operation myself. I don't have page
Do
managers or
you
anything.
really?
Everything, yes, I post everything. All my inbox, I answer myself. I do everything myself. Of course, unless where Anonymous wants to say something, then Anonymous can post
The
something. But of
famous
course, it has to be done
Anonymous.
through me. So unless where Anonymous wants to post something, but then Anonymous can post through me. But Anonymous has no access to my inbox. My inbox is a bit of a sacred issue because in my inbox, people tend to share very intimate, issues pertaining to their health.
Yeah.
So we have to maintain confidentiality, and that's precisely why I am the only one who has access to. And that has come with challenges because the inbox or even the comment section can get so busy, and I'm unable to meet the need because I'm just one person. I
Yeah.
can't answer every question. I can't attend to every concern. And so one thing we've done creatively is that if a concern is frequent, we create a topic around it, and then I go live and try and address the concern. And I hope the page is helping people out there.
Well, I think you should stop hoping. It is helping people. I know for a fact it is helping people. There's a group of men here in England, British people, who actually have got nothing to do with Africa, and they're doing things that apparently Dr. Mujajati said you should do, which is fascinating in itself. So it is quite interesting. Now, I'm interested in Anonymous. I can't say
Yes.
who is anonymous because that's a silly question. He's meant to be anonymous. How do you get information from Anonymous?
Well, we have a way of communicating with each other. So Anonymous would come up with something and uh, and and share it with me, and I would put it up. I kind of have no choice in the matter. When Anonymous wants to say something, Anonymous will say something.
It sounds like Anonymous needs to have his or her own Facebook page or Instagram page, because I think they're getting quite famous. It's like whatever you post, people will be like, "What would Anonymous say?" And I remember you went to this event a few days ago, I think, and
Yes.
you have a liking for Mampi, which is quite hilarious in itself. Uh, and so you took a picture with her, a very beautiful picture. And the comments underneath were so funny. Sometimes I look at your post and then go to the comment section. It's just hilarious. And I don't know, Mampi was looking very glamorous as she usually does. And people were saying, what would Anonymous think? Or what is Anonymous thinking right now? Are you doing the right thing? Or just silly little comments like that, which is quite funny.
Yeah. So the issue with Mampi is that I've followed her music for a very long time. I think I've followed her career from the time she was very, very, an upcoming artist. and to where she is today. I've admired her career for one simple reason that she's, I think, one of the most disciplined, in my opinion, female artists that we have.
Okay.
And I admire the way she has managed her career so far. I think she's done a good job. And I respect her craft, both from a business standpoint. I mean, you can't be in the public eye for the duration that she has and continue to be successful for the duration that she has. You must be doing something right. Yeah.
That's true. Longevity. She has had longevity.
Yes, she has that. And yeah.
That's really good. So before we get into the serious stuff of the topic for tonight, I just wanted to know a little bit about your background. What were your parents into? How did you get into medicine?
Right. So my parents were okay. First of all, my father is a private person who, for most of his life, ran or rather managed his own businesses or his own business, mainly construction. Education-wise, he didn't go very far in school. He didn't go beyond grade 8, I think, the former grade 8. But he's a very innovative man, very hardworking, very inspirational man. If you look at what he has achieved compared to what if you look at his educational background and what he has achieved, both for himself and for his family, he continues to challenge us, his children. My mother, equally, I think she went up to grade 8 or 9 with school. And for her, I think the main thing she did and continues to do to date is that she's a business person. So she's always been selling something. And then I think I got my business side, or I was taught or indoctrinated into doing business by my mother, because most of her businesses I was always involved in one way or another. How did I become a doctor? Well, I think I was born into a family where our parents, there were two things you couldn't get away with. One was going to church. They had no compromise on that. You just had to go to church. It was non-negotiable. The second thing that was non-negotiable was going to school. They were so obsessed about, sending kids to school that they made it a big issue if you missed class. They'll always check your books. For example, I had learned, I was homeschooled for I think 2 years or so by my mother. So I had learned how to read and write before I even started my grade 1. By the time I was getting into grade 1, I was this genius that everyone was always surprised at, not knowing that I was taught from home. And so she made a lot of noise about going to school. So for me, I went to school to keep her quiet because I thought she made so much noise about it. So I did school just to keep her quiet. I didn't think school was important to me until I was in grade 10 at Hillcrest Secondary School. That's where I bumped into people who thought school was important. That's when I heard about careers for the first time. That's when I heard about people, studying law, studying this or the other. My initial interest in terms of careers was actually to do law. I'm sure Muncha would actually be very excited to hear that.
It's not too late.
So my initial interest was to do law. So, but then along the way, for some strange reason, I was very good at science and maths. And one of my careers guidance teachers at that time, we used to have career guidance teachers in Zambia at one point, insisted that I can't do social science because I was very good with mathematics and science subjects. He thought it was going to be a waste. So he insisted that I consider medicine. And at that time, to go to the University of Zambia, we used to apply in our second term of grade 12. And your acceptance letter came in the mail. So when we did our application, he made sure that I signed for the School of Natural Sciences. And the rest is history. More recently, I tried to go into law school. And I did law for a semester. I think I did law for 6 months.
Oh.
I didn't sit for exams. I ran away. I thought it was tough.
Really? You did medicine and you thought law was tough?
Yes, don't tell Munsha that. I'm sure he'll be very excited.
I'm sure he'll listen back to this. And I'm just thinking, I'm almost thinking I should bring my daughter downstairs so that she could hear the bit where you talked about sciences and social sciences. She wants to do law, but I'm thinking it's a waste because she's really good at maths and sciences. So I will cut that clip and just listen to the good doctor. Your father listens to him. You should do the same. Hopefully she'll be inspired. Brilliant. All right, then. Now let's dive into the topic for today. But I just wanted to briefly get to know the man behind all this stardom. Viewers, if you just joined us, welcome to TVBAKWETU, and I'm your host, Linda Banks, having an intimate conversation with Dr. Mujajati, who you all know, he needs very little introduction. He is this mega star. And we're going to be talking about erectile dysfunction, the myths, what it is, what people think it is, what causes it, and all that sort of stuff. So grab yourself a glass of water. And you're feeling fancy, get a melon as well as we get into this topic. So, Doc, can you just dive into what this thing is? What is erectile dysfunction and what causes it?
Okay, so in terms of cause, the causes are quite a number, but in terms of definition, really, is basically failure to obtain and sustain an erection for sexual intercourse. That's basically the basic definition of it. Now, when you go deeper into the subject, you will find that a poor desire for sexual pleasure also becomes part of the problem or part of the cascade of erectile dysfunction. So in terms of causes, you have causes that where people are born with certain causes. They may have a gonadal or sexual development problems, where they don't have, certain things properly developed. Maybe the gonads are not well developed, or they have a mixture of certain sexual characteristics that are in the middle. Either you are intersex, and so sometimes some of these things do happen to people, or you have certain hormonal problems that you are born with, and you grow up with them, and they continue giving you problems. So there are causes where you are born with them. Some are genetic, some are because of certain deficiencies that you were born with. Now, there are also some acquired causes. Acquired causes that you can control. There are some acquired causes you can't control. For example, you can't control age. As you grow older, these things begin to fail to function as well. So you can't control for that. But there are other acquired causes that come with things, for example, obesity, excessive alcohol abuse, diabetes is a very important acquired cause, especially uncontrolled diabetes, uncontrolled hypertension, and several other related causes. With obesity, you're talking about high levels of cholesterol in your system that can lead to things like this. Now, there are other also acquired causes that you can control for that have to do with stress, domestic, I would call it a situation where you have domestic issues in the home. That can
nagging wives.
Nagging, yes, a nagging wife, and it's a real thing actually. Unfortunately, that nagging can actually cause erectile dysfunction. It is a real thing. Yeah.
Interesting. You were talking about genetics being one of the causes. I know with certain diseases, it comes from like the father's side or the mother's side. Is it similar to erectile dysfunction, or does it not matter?
No, it doesn't really matter. Depending on the disease that you're dealing with, it doesn't really matter.
like with erectile dysfunction, because I remember listening to you talking about how certain people inherit certain genes from either the father or the mother. So with erectile dysfunction, it's not clear as to which side of your parents you inherited from.
Yes, it doesn't matter. What matters is how does the disease impact the functionality we are discussing. For example, somebody could have Parkinson's disease, and Parkinson's disease is a complex illness, and it has a genetic component to it, but it's also associated with erectile dysfunction. Yeah.
Interesting.
Certain drugs that we give people to treat certain conditions can actually predispose you to erectile dysfunction as well.
What sort of popular of most commonly used drugs are susceptible to making people get erectile dysfunction?
You are talking about the drugs that we use to treat psychiatric conditions.
Okay.
Yeah. Some of the antidepressants that we give. Some of the antihypertensive, especially beta blockers like atenolol, if you take it for a prolonged period of time, you can do that. Some chemotherapy drugs that we use can do that as well.
Right. Now, I know there's so many myths that surround this topic. Could you just tell us some of the ones that you hear mostly at your practice and how you can debunk them?
Well, I think most of the things, most of the myths that we hear, and the one that I'm hoping that we can address here going forward, is this thing where you have a friend or a drink buddy who struggled with erectile dysfunction and was given a concoction somewhere and it worked for them, and you believe that it worked for you as well. Also, the size of the manhood is a big issue for a lot of people, and they do all kinds of things to themselves to improve or to enhance the manhood in terms of length or girth. This ties in with the issues of tightening, vaginal tightening and things like that. There are certain myths to do with how long people can go. You know, people tell each other all kinds of stories when they're, they tell each other, no, me, I go for an hour, or me, I go for 2 hours. And so that also puts pressure on the person, that how come me, I only go for 15 minutes and my friends keep saying they go for 1 hour, or me, I go for 5 minutes and everybody goes for. So those are some of the myths that, people tell each other. What we need to appreciate is that when it comes to sexual relations, individuals are very different. We are as different as our faces are. There's no one size that fits all, really. So that also exerts a lot of pressure on men, and that is where some of the problems come in with erectile dysfunction as well, because with that pressure comes anxiety, performance anxiety as well. And because they are anxious, instead of focusing on the act, they are focusing on the clock. Focusing on their timer, on their stopwatch to see how long they are going to last, and instead of focusing on enjoying the moment, and that also puts pressure on them, and that also breeds these kinds of problems.
Interesting. So earlier on, you mentioned that women use a vaginal tightening product. Do you think that also have got an effect on erectile dysfunction? How would that have an effect on that?
Well, I tied it in because it's related to the issues of, a penile enlargement problems. But it has no direct link to erectile dysfunction in terms of vaginal tightening has no relationship on erectile dysfunction.
No. Okay. I just wanted to for you to clarify that, because I think
okay.
Yeah.
No,
someone getting like
what's the relationship?
Exactly. What's the relationship between that and this? Brilliant. Now, how can you prevent this condition?
Well, like we remember when we're going through the causes, there
Mm,
are some what we call modifiable causes and non-modifiable causes.
mhm.
There are just certain things you can't do anything about. For example, you can't do much about the fact that you're growing old, that age is catching up with you.
Mm.
You can't modify for age. Of course, there are medications we can give you to improve the functionality or to improve erectile dysfunction, but you can't
Yeah.
do much about that. For example, if you inherited genes for multiple sclerosis from your
Yeah.
parents, or
Mm.
you inherited genes for Parkinson's disease, you can't do much about those. Yeah,
No.
yeah. But then there are things you can do that help to prevent. For example, we talked about high blood pressure as one of the things that can induce erectile dysfunction. We spoke about um, high cholesterol. We spoke about diabetes, especially type 2 diabetes.
Mhm.
Now, these things can be controlled, and you will find that type 2 diabetes, type 2 diabetes, high cholesterol, and high blood pressure, they form a syndrome called metabolic syndrome. And when you look at that syndrome, it's an acquired syndrome. And it's common, very, very common in people who are overweight. So you can therefore say that if somebody can manage their weight and avoid gaining too much weight and also engage in exercise,
Mhm.
they can actually prevent getting into problems of erectile dysfunction. We talked about abuse of alcohol. That's modifiable. We also spoke about tobacco, smoking.
Mm.
So if people can quit smoking, and people can drink alcohol in moderation and get enough sleep, it can
Mhm.
actually, help in preventing or rather even reversing some of the erectile dysfunction that people experience. So those are some of the things, and of course, there are things that may reduce your levels of testosterone, especially if you're on certain drugs,
Mhm.
and depending on how long you're on those drugs, some things can be done to assist you to boost your testosterone. You can boost testosterone naturally. You can also be given the actual testosterone injection, depending. For example, there are certain diets that can help boost, your testosterone. Yeah, that's where the watermelon comes in.
Ah.
That's where eating watermelon seeds comes in. That's where eating nuts comes in. And I'm talking about all nuts except for donuts, but any types of nuts. We're talking about cashew nuts, hazelnuts, brown nuts, name it. And that's where those come in as well. So avocado, very important. The reason avocado is important is because it contains a lot of the good cholesterol, and you need the good cholesterol. You do need the cholesterol anyway for you to manufacture the testosterone that you need. And and avocado is probably has the largest content of good cholesterol in nature actually. So those are some of the foods that men need to use frequently.
Fantastic. You're talking of avocado. No, Bokunoko, England, a small bit of avocado. So people in Zambia make use of those free avocados that just grow in your backyard. You popularized watermelons. What is so special about the watermelon? What is in the watermelon that is so beneficial for men?
There's a chemical in there called the lycopene, and it helps to improve blood flow. And oh no, with it helps to improve blood flow. And if you understand the mechanism of the erection, you want a good uninterrupted blood flow. And that's basically what it does. So it helps with improving blood flow, and with improved blood flow, it improves the strength and duration of the erection. But then, like most other natural remedies that you will find,
Mm-hmm.
the value is not in a one-off use. And this is what we keep telling men. It's
Mm.
not enough that you ate a whole truck of watermelons in one sitting. It's not going to change anything. What will have an impact is if you eat watermelons or you incorporate watermelon into your diet on a regular basis. That's when you get the benefits. Now, there are certain portions of the fruit that are that have a higher content of what we're looking for. So you're talking about the rind of the watermelon, the white portion of the watermelon. So that's why we talked about remove the green skin. If you can use a potato peeler, even better still, and focus on the rind of the watermelon. You can eat it in a salad. You can eat it on its own. It's really up to you. Yeah.
There's a question on the screen from Victor. At what age do we most likely experience this problem?
Well, it depends. Generally speaking, you will find that for acquired causes, like if you're talking about hypertension, diabetes, high cholesterol, and alcohol abuse and smoking and things like that, what we have seen even at our own clinic, we see men in their 40s and above who come with those problems. If you see somebody who is below 40 coming with a problem with erectile dysfunction, you will find that probably it's something that either they were born with, or they are having a problem where maybe they previously had a problem in their gonads and they are having a very low production of testosterone. And they would even have accompanying features that suggest that somebody has a hormonal problem that is also inducing this. But otherwise, generally speaking, if you don't have these issues and you're below 40, this shouldn't be a problem. We see these things begin to have an effect because remember, naturally as men, when we reach the ages of 45 and above and going upwards, our testosterone levels begin to drop naturally. It's a normal phenomena, and every man should expect that to happen. So if you ask me at what age do you expect this, it varies depending on the person who is affected. But what is important is that if you're experiencing these things where your desire for sexual intercourse has reduced, you cannot sustain an erection, you can't obtain an erection, seek help. And there are several places where you can seek help. We offer that service ourselves at CarePick Specialist Clinic in Lusaka, but I know that you can still get the same service from UTH, I think, and several other places.
So when you have a man walk into your practice, how do you experience them? Is it easy for men to discuss these problems? What is the general kind of meeting like? They come in, they explain what their problem is, and what sort of help would you offer them? Not apart from prescribing a whole bunch of watermelons and drinking lots of water.
So, you see, men by nature struggle to explain or to even get into issues that affect them, partly because of pride, and partly because for men, it would be, for some men, psychologically, it's an admission of weakness. And because of that, it has created a barrier for men to, seek help. But those that manage to come and those that manage to reach out to us, what we have done is that we've created a very safe space for men to express themselves. And so because of that, a lot of men who come to us, they find it a lot easier to explain themselves. And we also prompt them. Because you see, for example, a man comes to you to us, and for example, we are treating them for hypertension. We make it a point as a facility to deliberately ask, to say, look, we know you have hypertension, but also one of the things that can happen for somebody who has hypertension that has been poorly controlled, it is this. Are you experiencing these things? Or if somebody has diabetes, we deliberately start the conversation ourselves. Or if we see somebody has been smoking for a very long time, or is excessively using alcohol, or they are slightly overweight, we induce these conversations ourselves. But men do report themselves, and we've noticed ourselves that there's been an increase in the number of men who are bringing themselves forward, and also we've seen some very good results as well in terms of men who are receiving the help they need. But again, the help is also tailored. There's no one size that fits all. Some men just need to be talked to. You'll find that majority of them actually just need to be talked to because they have believed wrong information. Remember, you asked me about the myths.
Yeah.
So in most cases, you find that some men just require counseling. He just needs to be talked to. He has believed things that are not true, and that is affecting his sexual life. And most of them is like that. Others, it's because maybe they're having problems at home, and you'll find that when they resolve them, they don't need drugs. Not every erectile dysfunction case needs medication, and that's what we have observed as well. So that's why it's important that if you're experiencing these things as a man, come forward. There are several places you can go to. Like I mentioned, you can go to the Invest Teaching Hospital. You have experts there. You can still come to CarePick Specialist Clinic. We'll still receive you. No problem. I see you have a question from someone.
Yes. Laston says, Dr. Aaron, good evening. Can we also associate chronic untreated sexually transmitted diseases with erectile dysfunction?
Yes, you can. Yes, you can. And this is where you have an infection that, say, for example, you have epididymochitis. Okay, epididymochitis, this is an infection that extends to the testicles and its tubes and all that. And you've had this infection for a very long time, and it's also and it's been chronic, and it's basically affecting the production of testosterone in those areas. Yes, you can. That has been observed.
Okay. Now, going back to remedies, do you think mutototo, I hope I'm pronouncing that right. Someone sent me that question, or Congo dust even, as a medication for erectile dysfunction. Do you think that is viable? Does that work? And if it does, how does it work?
You see, this is like several other disease conditions that we have. We have traditional medicine. We also have conventional medicine. And our colleagues who practice traditional medicine, they will tell you that they do have remedies for different things that they treat. If you take countries like China, for example, they do have a formally organized traditional medicine, practice, and also a conventional medicine practice. They even go to universities for that. I'm one of those people who has advocated for Zambia to introduce a degree in traditional medicine because I think there's value in our herbs, and if we can appropriate the herbs properly, we should be able to derive value. I'm not one of those practitioners who wants to take herbs and throw them away completely. But at the same time, I've also seen people who have been messed up because they've not used the herbs properly. Yes, Mtototo works. Yes, Congo dust works. But
how does it work?
How then do you use it? It works like sildenafil. It works like Viagra for the most part. Yeah. So then the same way you can overdose your Viagra, you can still overdose your Mtototo. So it matters who is giving it to you. What experience do they have? Who taught them how to prescribe Mtototo? What experience do they have? So one of the challenges we've had on the conventional side with our practice of traditional medicines is that, first of all, it's not standardized. Okay. And because it's not standardized, we've also observed people who have had problems because they've ended up with a kidney function, liver failure, kidney failure, and things like that, in addition to those things. But be also careful with things like Mtototo and Congo dust. Remember that an erection is supposed to last a certain period, beyond which the penis begins to die. And people sometimes, we don't emphasize this enough, or maybe we're not getting the message across enough. Because if you've given Mtototo to somebody and you've given them a dose that is bigger for their body weight, they will have a prolonged erection, and it will become what we call priapism. And priapism is when you have a prolonged erection which is painful. When it gets to that stage, it becomes an emergency. And we do see in the emergency room people who come with, priapism. And if you inquire properly, you'll find that they either took Congo dust, Mtototo, or some concoction of some kind. And then you now have to work very hard to try and save the penis, because if you don't, that's the last erection that someone will ever have.
And how do you treat that?
Oh, you have to remove the blood. You get a needle and you have to start removing the blood from the
Can't
body.
be very nice, I don't suppose. Now, I wanted to find out if there are any similarities between the symptoms for prostate cancer and erectile dysfunction.
There's a very interesting relationship between prostate cancer and erectile dysfunction.
Pray tell.
When you were asking me about the causes, one of the causes of erectile dysfunction sometimes is one of the complications that can arise from treatment for prostate cancer. Yes. It's not a very common complication, but it sometimes arises where if somebody had surgery, okay, that involves, say, for example, removal of the prostate, or sometimes you find that when we are treating advanced prostate cancer, one of the ways that advanced prostate cancer is treated is to deny the cancer testosterone. So they do that in two ways. They'll either give you medication or they use surgery. In trying to use surgery to manage the situation, they will remove the testicles because they're the ones that are producing testosterone. Or they'll do what we call a medical castration. So they will give you what they call some drugs to, Now, in doing so, you are removing the testosterone, and as a result, one cannot have an erection.
I see. We're going to take a few more questions from our viewers. There's one from Victor, who's our regular viewer. Is it possible after 40 to have sex every day, or failure to that will be construed as ED?
No, it's not construed as ED. Understand that ED, or erectile dysfunction, is failure to obtain and sustain an erection for sexual intercourse, or loss of sexual desire. That's the basic definition. It's not about how many times one has intercourse. No.
Okay. Let's take another one. Okay, someone is just saying we're about to have a shortage of mtotototo.
He should be careful with it. Be very careful with it. Let me sound a caution. Be very careful with who is giving you these herbal medicines. Very careful. Make sure that it's somebody who has the required experience to use the herbal medicines, and don't just get things because your friend said they used it and it worked for them. It may not work for you. Yeah.
That is very true. Now, we have been joined by one of our TVBAKWETU family members, Patrick. Good evening, Patrick. What is your question for the good doctor?
Good evening, Doc.
Good evening, Patrick. Good to see you.
Good to see you, Doc. And I pray that so many men are watching you, because, as you said, men are scared of going to the doctors. Yeah, and it was a very good topic discussion, Linda. Very good presentation. Doc, there was only one thing I wanted to ask you. It's actually it's about prostate cancer, because
Right.
prostate cancer affects more men than erectile dysfunction. Like in the UK, statistics show that more men suffer from prostate cancer than any other cancers. So is prostate cancer hereditary, or can it be prevented?
Well, the simple answer to your first question, is it hereditary? The answer is yes, it is. Can it be prevented? We don't have, at present moment, a solution to prevention. We don't. So to answer your second question is that no, you cannot prevent prostate cancer. There's been a lot that has been written regarding prevention, or reducing the likelihood, or delaying the likelihood. A lot has been written about that. But do we have something I can tell you to say, go and do this to prevent prostate cancer. No. So why is prostate cancer hereditary? First of all, if you look at your statistics, even in the UK or here in Africa or Zambia or the US, you will find that prostate cancer is very common in the black race, so in black people. And then followed by Caucasians. It's very also common in Caucasians. Then closely followed by Hispanics, Indians, and then Asians in that order. And then also the other thing you will find is that prostate cancer is very common in people where you find that in your family, if there were people with prostate cancer on your father's side of the family, then it increases your likelihood. If prostate cancer is on your mother's side of the family, the likelihood is far less. The other issue is age.
Oh, sorry.
Mm-hmm.
The other issue is age. So the older you are, for example, if you're above 55, 65, 75, in those ranges, the likelihood of prostate cancer also continues to increase. So it increases with age. So there are many risk factors to prostate cancer, but 3 are quite fundamental of the many. So you're talking about genetics, you're talking about race, the fact that you're a black man, and also lastly, age.
Fantastic.
Just a follow-up question on that.
Oh. Mm-hmm.
Doc, on prostate cancer, here in the UK, obviously, you know, when you go to your surgery, they keep those records, and they know that every person reaching a certain age, 50 and above, they have to refer them to specialists for certain cancers and diseases. It just comes automatically. You're talking to your GP and they say, oh, you're above 20 or 40 or what? Is there anything like that in Zambia? Because here in the UK, I think most men after 50, they must have been referred to the doctor, even without asking. Because they've got the statistics, their age and everything, they're African. If we got something like that in Zambia. And then the other thing, you mentioned about prolonged erection. I knew somebody, I don't want to go into details, so many people knows me. He wasn't using Congo dust or anything. He was a young man, middle age, he wasn't even married. He used to have prolonged erection when he, when he's with a woman. Not, obviously when he's aroused. And so many times I took him to the hospital, nearby hospital, and he was treated. So what could cause that?
Okay. What race was the person? Was the black person?
Was black person, my relative.
Yes. Was he tested for sickle cell disease? Because you see,
no, he wasn't a sickler. He was a normal person.
He wasn't a sickler.
No, okay. He wasn't.
Because priapism is very common in people who have sickle cell disease. How built was he? Did they check his cholesterol?
No, he's actually had more cholesterol than him. I've been big, more cholesterol like him. Yeah, but like me, Doc, I'm big, but my cholesterol is normal.
Right.
It's within the range. But him, he was. I don't know, Doc. Is there a relationship between being big and cholesterol? Because he might have had cholesterol, but he was smaller than me, much smaller than me.
Being overweight does not necessarily mean your cholesterol is high, and being small does not mean your cholesterol is low either. Yeah. So until it's measured, then you know for sure. Yeah, it has to be measured. Now, there was a question you had earlier. What was the other question?
I think it was about about prostate cancer. I was saying not only prostate cancer.
Oh, you were saying
Like one of the common cancers in the UK is bowel cancer.
Yeah,
everybody above, I think, 55.
Yes.
They automatically, whether you like it or not, they will refer you to a specialist to have a bowel cancer test, and prostate is one of them. Do we have such facilities in Zambia?
So ideally, that's what you should have. But again, remember that you are the UK is a resource-rich environment, and on our end, we are practicing medicine in a resource-limited space. So your resources have to be prioritized to areas that are really needy, and also the cost of trying to do that. Now, you will find that screening for prostate cancer nowadays has become very easy and literally very inexpensive. That is why you find that a private facility like ourselves, we were doing free prostate cancer screening just the other day on Saturday, actually. That was yesterday. Saturday was yesterday, I think.
Yes.
And we offer the same at our clinic. So for men who are 45 and above, we offer it. We have an opt-out system at our clinic, so we offer men to do screening for prostate cancer. As a page, we've taken it upon ourselves to encourage men to go for prostate cancer screening. But is it routinely done in our facilities? No, it's not.
Thank you so much. Bom Levi, in the last few minutes, could you kindly ask your question?
Good evening, Dr. Kimanziwani.
Kimanziwani sha, mwapira.
Lwapira lwiketire tate. It is onachwalo ainya na inya. Ati how do I say tafichira pabwali mwasilozi.
Amkandeke zabina kizifi. Aluto.
Well, doctor, I have 2 questions and I'll be very brief. The first question is on masturbation. What's your take on this myth of masturbation being a taboo issue in Africa, especially in our home country, Zambia? And meanwhile, this is what helps a lot of youths out there in boarding schools or whatever.
Could you ask in relation to erectile dysfunction, please?
Actually, that is where I'm going to go in there, yes. But it's just on that aspect, on the myth. There's this myth where it's a taboo, considered as a taboo. And the other issue, what I wanted to talk about, or rather ask your doctor, is on the exercise. A lot of us men in Africa or anywhere in the world, when we look at the status of a person, we consider the weight, for example, kamimba, potibellies, as a status, and many women would rather kill themselves for that belly, knowing that that is where food is coming from. This man has the potential to provide for the offspring. How do we bring down that? Or what's your take on that aspect where men are lacking, or we are lacking to exercise ourselves, and we indulge ourselves in alcohol and all this luxury type of life where we don't exercise and we are overweight and we die young, we die early. The lifespan in Zambia is so low. So how do we mitigate this problem? And with in relations to Bolinda's concern, dysfunction, erectile dysfunction. That's my question.
That's a very important issue you've raised, and I'm going to start with your last question. You see, you will find that exercise solves a lot of health-related problems. Remember that your body as a human being was designed to move, not to sit. If you look at the biology of the human being, you were literally engineered to move. You were not engineered to drive a car, to sit in the car the whole day. You were engineered to move. And so now with exercise or with movement of any kind, your body has to move. So exercise solves a lot of healthcare problems, including erectile dysfunction. And I'm glad you've raised the issue. Now, what type of exercise are we talking about here? We're not talking about intense exercise. We're not talking about exercising the whole day. No. What we're talking about is that you need to have a regular routine that you use for your exercise. Whether it means you walk, whether you swim, whether you do aerobics, I don't know what you do. But bottom line is that you have to have a schedule, and it has to be consistent. And I think the key word when it comes to benefiting from exercise is the same with the benefits you derive from food. I think me and Linda were discussing the issue of the watermelon and other foods earlier. The issue is about consistency. For example, if you went into the gym today and when you were done exercising today, your weight didn't change, and it will probably not change at all. You can exercise the whole day, your weight will not change. But what will happen is that with consistent exercise, whether you're doing it for 30 minutes per day, provided you are consistent, within 6 months to a year, you will start seeing results. You will not even need to just start checking yourself. The people around you will see the results, and they will remind you that, they are seeing a difference. Now, we have to make exercise a lifestyle. For example, if you take the heart of a person who does regular exercise and a person who doesn't, there's a major difference. If you take blood vessels, the tubes that carry blood, of a person who does exercise and someone who doesn't, there's a major difference. The person who does exercise has more healthier heart, has more healthier tubes, has better blood circulation. Are you surprised that they don't suffer from erectile dysfunction? No, they don't. Why? Because their tubes are more patent, there's better blood flow, and their hearts are stronger. That's why they even last longer. So that's why exercise is very important. Masturbation. It remains a taboo in most of our cultures here, for good reasons. Are there any health risks to it, as in physically health problems to it? Not really. Not much has been described in scientific literature or observed. The risks usually come from technique. So if somebody is using a technique that is aggressive, yes, they will have abrasions on their, privates. The only other challenge you will have with masturbation has to do with your core values. For example, if you're a very religious person, you will suffer problems of guilt. People even go into depression because of the same. So really, for people who are deeply religious, you want to discourage them from indulging in these things, because remember that mental health is equally just as important. But otherwise, in terms of affecting your well-being as a person physically, there is no evidence to suggest that.
No. Lovely. And no link between having erectile dysfunction as a result of excessive masturbation?
Nothing of that sort has been described.
Okay, lovely. Thank you so much for that elaborate explanation, Doc. Nyachsengu, do you have a question?
Good evening, everybody, and good evening, Doctor. I was going to say hello to you in Lunda, but I'm sure you probably won't understand it. I'll just say hello here. I would like to ask you a question. I work in healthcare here in Canada, and I was actually going to talk about masturbation and the relationship between masturbation and erectile dysfunction. I thought one way or another they were related. I don't know whether there's some research that's been done around them, but I'm not a doctor, of course. I think you've answered that question. The other thing that I wanted to ask you is that in Zambia, knowing that it's not only Zambia, I think it's around anywhere you go, men are very, they're not ready to go to a doctor, even if they have a cough or whatever it is. But is there a way you can come up, or in Zambia, can we get maybe some sort of a what do you call it, on the TV, on the national TV, that you're given some sort of a space where you can go maybe every week to just talk about men's health? Is that a possibility in the New Dawn? Thank you.
That's a good question. I can't speak for the New Dawn government. I'm in the private sector now. I used to be a civil servant for, I think, close to 15 years. Now I'm 100% in the private sector. For now, the only avenue I have that is available to me to provide health information is the Facebook page that I run. I do collaborate with other radio stations, some TV stations in the country. I work with them, but not on a regular basis, though. I think I do more consistent work on social media on my page. Recently, I have done some work with MTN. We are putting out health information on MTN, so people can dial for free and listen to health tips. But those are not specific to men's health; they are just health in general. We've also tackled men's health topics on MTN platforms as well. So, yeah.
Fantastic. Thank you so much, Doc, for your generosity in spirit, generosity in time. I know you're a very busy man, and we have overshot by 8 minutes. We've got another program that is just starting, it's going to take a different trajectory. We're getting into politics, but I wanted to spare the Doc from that sort of conversation. Now, I would like you to touch on what you're doing for this season, this month of advocating for men's health, because you've got a special function taking place. Could you just kindly let our men know a bit more about what you'll be doing before we close?
Right. So yesterday we were doing men's health, commemorating Men's Health Week. So we did something yesterday at this the Barcelona Academy. It's a sports complex where men were gathered to do exercise and things like that. And we were on hand to do prostate cancer screening, and there were other screenings going on, including circumcision was also going on there. And as a clinic, we will continue to do what we do. And as a page, we'll continue to do what we do in terms of trying to encourage men to access healthcare and not to be afraid of hospitals. Men are just scared of hospitals. It's a well-described fear. It's well documented. It's not well understood why men fear hospitals. That's precisely one of the reasons why men don't live as long as women do. But it's a sad reality, but that men are afraid of hospitals.
So luckily enough, with your Facebook page, this exercise doesn't just end in November. You carry on your Facebook page, encouraging men to look after their health.
Yes, I mean, we've done that from January. We do it from January to December. We don't stop encouraging men. We keep going.
Fantastic. Well, thank you so much, viewers. It's been an absolute pleasure and delight for you to join us. I've been your host, Linda Banks, with my special guest, Dr. Mujajati. Now, Doc, will you come back so that, because the women are saying, what about us? Will you come back? Promise to come back so that we can discuss women's health.
We can compare diaries and see which day fits, and I should be able to come back.
That would be fantastic. There you go, ladies. So we haven't forgotten about you. Thank you so much, and good night.
Good night and enjoy.